It is 5 minutes past 11. You are listening to the Mid-Morning Talk on Salam Media with me, Mari Mkwanda. November is National Diabetes Month, a time when communities across the country team up to bring attention to diabetes. Diabetes and urologic diseases are very common health problems that markedly increase in prevalence and incidence with advancing age. Diabetes is associated with an earlier onset and the increased severity of urologic diseases, resulting in costly and debilitating urologic complications. What are the best ways to treat them? Well, let's find out with urologist Dr. Salim Choonara. Assalamu alaikum wa rahmatullahi wa barakatuh, Dr. Choonara, and shukran for joining us once again.
Walaikum salam wa rahmatullahi wa barakatuh to you and to your viewers and listeners, and thanks for having me again. I appreciate it.
Alhamdulillah. Now, what is the relationship or the link between diabetes and urological complications?
Yes, this is a fantastic topic, and I'm glad we're raising this. Just a quickly side note, we often focus a lot on the more dramatic, I would say dramatic in inverted commas conditions like your cancers and those kind of things, and it gets people talking a lot and it gets people's attention. But, diabetes is almost like the silent disease in the background, People get diagnosed with this, and then they don't initially develop lots of complications initially, but they live with diabetes. And over time, this condition in the background is causing significant bodily complications, almost affecting every organ system in the body. So diabetes is a very significant disease, and I'm very glad that we're bringing up this topic today. What relevance to your question? Yes, diabetes has many implications in the urological system. I will just list them, and then obviously we can maybe expand on each one of them individually. So if you look at the broad categories of where diabetes has an impact medically on the human body, or especially on the urological system, it's as follows. One, it has a significant role in terms of formation or production of kidney stones and all kinds of stone-related issues. So kidney stones is one big area. The risk for infections, people that are diabetic are more at risk for urinary tract infections, and also as a result of that, infections are likely to spread to the kidney, what we call pyelonephritis, and the many attendant complications that go with that. The other big group is what we term as a neurogenic bladder. In other words, it falls under the category of where diabetes causes what we call a neuropathy. Neuropathy, in this case, referring to the nerves, the nerve supply, the nerve damage. And in this case, we're talking about nerve damage to the bladder, where these patients have what we call a neurogenic bladder, or a flaccid type of bladder, where they're unable to urinate for themselves because the nerve supply, the circuitry to the bladder becomes deficient. And as a result of that, they require an artificial way of emptying the bladder, which is quite debilitating. And then another big group, which affects mainly the male population, is the risk for things like erectile dysfunction. Diabetes is a significant factor in terms of erectile dysfunction, especially in we've seen this across the age group, in younger individuals also that are diagnosed with diabetes at a young age. These kind of complications do set in quite early and can be also quite debilitating as well.
Right now, why are diabetics at an increased risk for UTIs and other infections?
Okay. So diabetes itself, as I said, diabetes is a global, it affects almost every organ system in your body. We're just focusing on the urological system right now, but there's effects on every single organ system in the body. So it's what we would term a systemic disease, It involves all the systems in the body. And one of the things that it does do is it leads to a decrease, or it causes an individual to become immunocompromised, People often used to understand this word immunocompromised when it comes to things like HIV and AIDS, but the word immunocompromised is relevant to many other conditions in the medical fraternity. And one big area there is diabetes, where definitely the immune system of an individual is lessened or is dampened. So in other words, their ability to fight off or to deal with an infection is deficient, is lessened, is somehow compromised. And as a result of that, they are at more risk of developing infections. And, particularly of relevance in our discussion today, it's relating to infections involving the kidney, especially. Those ones can, in some cases, can be actually life-threatening in diabetics. Where they would get a simple, for example, let's say a simple UTI, maybe let's look at a typical female, where UTIs are generally common, but they're diabetic, they get an infection. Ordinarily, it's self-limit, they take a short course of antibiotics, they feel better. But diabetics have this propensity where even if they've got an infection, their ability to fight off the infection is lessened. And as a result of that, the infection can easily spread and to involve the kidneys, and which can make the individual very, very sick, developing fever, severe pain, often requiring admission to hospital for intravenous antibiotics. And in some cases where that kind of infection can spread to their bloodstream, giving rise to things like sepsis and septicemia, and even can be fatal in some cases. So that's the mechanism generally of how diabetes can give rise to or make an individual more susceptible to infections. In this case, a urine infection.
And what about renal failure?
Absolutely, that's 100%. You're right. That's another group I didn't mention. Thank you for bringing that up. Absolutely. So the other big group. So the thing is, we look at them in categories. So, like for example, the renal failure group will fit into what we would call vasculopathies, or where the vessel damage occurs as a result of diabetes. If you think about it, just as a quick side note, so your listeners can understand, you often find that patients that are diabetic, they have problems with sometimes their eyesight. They can't see very well. They got problems with the feet. They get problems with sensation. They may get gangrene of the toes, and also because of the vascular effect. We're talking about the small blood vessels in the kidneys that get damaged, and as a result of that, it progressively compromises the functional units of the kidney. And as a result of that, it compromises the kidney function, and it can lead into renal failure. The thing is, often we don't always just see diabetes in isolation. People that are diabetic, sometimes they may have issues with obesity, they may have also hypertension. So you find that it almost becomes part of a bigger group of diseases, or a syndrome, or it may coexist with other conditions that all collectively are going to cause this damage to the various organs and systems in the body. But apart from that, we also know that diabetes by itself has the propensity, to affect the smaller vessels in the body, and as a result of that, in this case now with the kidney, like you're asking me about renal failure, it can give rise to significant kidney damage. Where people require dialysis and sometimes even renal transplantation.
All right, now let's go back to the ones that you mentioned earlier and expand on them a little so that we can get a bit of a broad understanding, especially when it comes to signs, symptoms, and what to look out for.
Okay, so one big group I mentioned was kidney stones, right? So we know diabetics are at higher risk for developing stones, and this is the main reason for this is because of the acidity of the urine. That's the one thing, right? And they're more likely to develop what we call uric acid type of stones. The problem with these kind of stones is that they don't generally show up on a plain X-ray, because they don't have much calcium in them. It's more uric acid. So generally the symptoms of kidney stones, people that have had kidney stones will understand it's quite severe pain, severe kidney pain or abdominal pain. There can be nausea, there can be vomiting, there can be blood in the urine. Those are generally the signs that would alert one day there may be a stone or something affecting the kidney. But the point here about diabetics is that it's really related to the acidity of the urine, and commonly they get affected by uric acid stones. So the treatment of this kind of situation, obviously, one is if there's a stone there, it's got to be dealt with either by laser or shockwave, or remove the stone. And then in those patients we know they are particularly at risk for developing stones, what we often do with them is that we have them on urine alkalinizers, to keep the urine out of the acidic range, to alkalinize the urine, which does have a role in terms of preventing and maybe even breaking down small little stones that may be developing, especially relevant now to diabetes, right? But now, in practical sense, look, we're focusing on diabetes here, but in practical sense, often it coexists. You may have, for example, a stone that has got a uric acid component, but also got a bit of calcium component in it. So it's not strictly only just uric acid, in practical terms. But relevant for our discussion with diabetics per se, especially those that are at risk for stones, one of the two important things here would be their water intake, which is important. And also they may require a urine alkalinizer. Now, I'm not saying every single patient who's diabetic must be taking something like citrus soda or something to make the urine less acidic. But I'm saying, you'll be guided by your clinician and your doctor and your urologist as to who's at risk and what should be your approach to this kind of situation to lessen the chance of you making a stone. So it's a broad group. I'm just giving sort of guidelines into these because these are all very, very big topics, and probably will take the whole show just to discuss every single one of them. The other big group which you mentioned, infections. Okay, I spoke about infections. We did touch on that right now. The other big thing which we see, and I think, we take this for granted, and often I see this in patients that I treat with those who have neurogenic bladders, which are what I mean by that in simple terms, is that the nerve supply to the bladder gets affected, again, because of diabetes. Remember, if we just think about diabetics that have problems with their feet, you often find they say they got no feeling. Sometimes they get burnt on their feet, they don't even realize it. Why? Because that's because of the neuropathic effect. In other words, the nerves are damaged, and as a result of that, the sensation is almost deficient in the toes or in their feet. Okay. Now, a similar kind of thing, if you think about it, where there's a nerve damage involving the nerve supply in the bladder. Now, the bladder got a very complex nerve supply. Because think about it. I mean, your bladder's got to fill up. When it fills up, you're going to have the sensation, okay, I must go to the toilet. When you get to the toilet, the nerves that supply the muscles must now contract to basically expel the urine. So it's a very complex coordination between sensation and your nerves, and as well as the muscles contraction and relaxation to allow you to empty your bladder. Now, if there's nerve damage that sets into the bladder, the one function that becomes deficient, actually two functions. One is the sensation. In other words, the bladder may fill up and they may not be aware that their bladder is so full. And the other thing is that even if they could feel the bladder being full, they have difficulty emptying their bladders, you see. And you must know, this is a massive lifestyle change. I mean, for an individual that can't empty their bladder, they have to require now some artificial way of emptying their bladder. Either they're going to have an indwelling catheter all the time, or if they are able to, and they can catheterize themselves every 3 to 4 hours to be able to empty their bladder. Otherwise, their bladders are just going to fill up, going to give rise to more problems. You can imagine, I mean, you can't walk around with a full bladder your whole life, or for a couple of years. At some point, you have to empty that bladder. The urine is going to be expelled, whether you do it yourself spontaneously, and if you can't, you need an artificial way of emptying the bladder. So that can be quite debilitating as well, And again, this stresses the importance of people that are diabetic to understand the importance of sugar control, Because, the point I was making earlier, Mariam, and I can't stress this enough, it's not something that's going to happen immediately, If you're diagnosed with diabetes, for example, today, most of these complications we're talking about now are going to set in maybe a couple of years from now, It's not going to be immediate. So the thing is, you feel, I feel okay, I'm okay, that's not doing me anything. But you don't realize it behind the scenes almost, this disease is slowly damaging organ systems. And somewhere down the line, you're going to see the effects of those complications in the organ system. And that's why it's so important that if somebody is diagnosed with diabetes, that they have good control, that they understand the importance of dietary management, so as to limit the damage that's going to happen to the organ systems that will only reflect years down the line. You see what I'm saying? So, you don't think about it like that because you're not being affected by it. So you think, it's nothing, it's not a problem, And then once you're faced with this problem, there's nothing much one can do about it because the damage is already set in. So I think that's something that, if all that comes out of the show is that point, then we've done massive help to individuals out there. And then also the other big group here is in men with erectile dysfunction, which itself is a big, big topic in itself.
All right, Doctor, let me catch you there for a moment. We're going to take a quick break, but we will definitely continue afterwards.
Thank you.
A sponsored water well and borehole allows children to go back to school, empowers communities, and is a means of sadaqah jariyah. There are many villages in Africa and Afghanistan that are in need of water wells and boreholes. Sponsor a water well in Africa at 14,500 rands, or a borehole in Africa and Afghanistan at 49,500 rands. Call Africa Muslims Agency on 011 834 8685 or donate at africamuslimsagency.co.za. Africa Muslims Agency, inspiring the spirit of giving.
Looking to get your kick? Kiki's have now reopened on 235 Matthews Maiwa Road in Durban. Head on over for the Taste with Kick. We offer something scrumptious for everyone in the family. Wraps, chicken tikka, burgers, tender grills, mocktails, milkshakes, and so much more. Corporate and events catering available. Visit our social media pages for more info or call 031 209 0119. Kiki's, the taste with kick.
At this time of trial and worry, the blessings of charity are the ideal means to avoid calamity and despair. The Al-Imdad Foundation gives you the opportunity to sponsor a share in a borehole in South Africa for just 1,000 rand and provide what the Holy Prophet, peace be upon him, called the best form of charity. Donate online at alimdad.com or call 0861 786 243 for more information.
Babu, why don't you loosen your belt a bit more?
But why now?
Well, it's very tight, blocking air to your brain.
Haju, this is only a start. I need to tighten up a bit more. Funds are tight and the cost of living is high.
Funds are not tight. It's your haram insurance which is tightening our baraka.
Okay, Haju. I will call my insurance friend tomorrow.
Maybe I must tighten up on my cooking from now on too.
No, Haju, we don't need to tighten up. It's okay. Look, I'm even throwing away my belt.
Don't tighten your belt. Change your insurance. Leaving Riba Insurance is easier than you think. Call Amana IFS for all your personal and commercial takaful needs. 0861 786 393. Amana. Leave Riba for good. Amana IFS is a registered financial services provider.
These days, I'm more health conscious than ever. So tonight, it's stir fry for dinner. Cooked in healthy Helios pure sunflower cooking oil. Helios is pure sunflower goodness, packed with omega-6. That's good for your heart. And is approved as part of the Heart and Stroke Foundation eating plan. Dinner's ready! Helios, pure sunflower cooking oil. A healthy family is a happy one.
Durban, KwaZulu-Natal has been the hardest hit by the recent civil unrest. Hundreds of supermarkets, factories and warehouses have been looted and destroyed. Thousands have lost their jobs and are in need of food and household supplies. Penny Appeal South Africa is currently on the ground working with communities to provide essential items to those severely affected. Donate toward the Penny Appeal Hardship Fund today and assist us in caring for families for a 3-month period with essentials and assistance to small businesses affected by the devastating effects of the unrest. Help us help our city. www.pennyappeal.org.za or call 031 11 00 573. Penny Appeal. Small change, big difference.
Listen to something fresh. Listen to Salam Media, your humanitarian broadcaster.
It's 23 past 11. You are listening to the Big Morning Talk on Salam Media with me, Mari Mukanda. And today we are talking about urological complications brought on by diabetes and how they can be treated with urologist Dr. Salim Choonara. And before the break, Doctor unpacked the relationship between diabetes and the urological diseases such as kidney stones, UTI, kidney infections, renal failure, etc. And now we're going to be looking at erectile dysfunction. Assalamu alaikum, Doctor. Shukr for staying with us.
Alaikum salam. Thank you. Thanks for having us again. Yeah, so just before the break, we sort of touched on erectile dysfunction, which, like I said, Mariam, each of these topics are so big. We probably spend one show alone just talking about them. But just some take-home messages relating to these aspects. Now, I must say, it becomes increasingly distressing when you see this kind of situation in younger individuals. And I must say, nowadays we do see a lot more younger individuals. I don't know whether it's the lifestyle issue. Maybe people are, not so mindful of their health anymore, obesity, or just diabetes. You do see a lot more of these complications, especially in the younger people. And, and some of them, they come and they maybe, the practical sense, they're getting married or in a relationship, and they're still young, and you find that erectile dysfunction is so real, so real in those situations. And we know that diabetes is a significant risk factor for erectile dysfunction. Again, early on when I mentioned to you, you asked me about renal failure, and we spoke about how you can get vascular damage to the kidneys, or vascular damage, for example, to the eyes or to the feet. In a similar way, that vascular damage that can set in because of uncontrolled diabetes that affects the penis itself can lead to significant erectile dysfunctions. And nowadays we've actually recognized, it's well described, even been proven in many studies and the research that has been done, is that in people that we now see with erectile dysfunction, that may be a precursor for them having other underlying cardiac conditions or cardiac disease. Why? Similar, again, diabetes, vascular damage, vessel damage on the heart, vessel damage on the brain, vessel damage, like I said, on every organ system, where them presenting with erectile dysfunction, we often send them as part of an investigation. We also get a cardiologist involved so that they can check out the heart and make sure that there is no problem at the heart level. It's also now presenting as erectile dysfunction because of this global effect on the vascular damage. So yes, definitely very significant. The thing is, in terms of, it's always important to give people hope, and not to make people feel down. So there is treatment available. There's good treatments available for these kind of situations, even for younger people that are in there that find themselves in this situation. It requires a holistic approach involving the sugar control, involving medication to treat the erectile dysfunction. So there are ways to manage the situation. But the important thing is to recognize and to understand that if I'm diabetic, it's important for me to look after myself because I may face these problems, down the line.
Right, Doctor, I know we've unpacked kidney stones, UTIs, and other kidney infections on the show with you, but quickly give us some takeaway points when it comes to, looking after ourselves better, to avert such situations.
Yes, absolutely. So for example, let's say diabetics that are known to are predisposed, for example, to stones. Let's just start with that point. So as I said earlier, water intake is important, right? And they must drink a fair amount of water. So at least about 1.5 liters to 2 liters of water a day. Increase their water intake, especially if you're going to be outdoors. It's now the very hot climate now. December, people are sometimes on holidays and they're going out. So be mindful of that. You want to in addition, as well, as I said, in those patients, especially where there's a risk for stones, I advocate my patients to take some alkalizing agent, whether it be citrus or alka first, whatever. There's so many on the market, and just to at least keep the pH out of the acidic range, so make it more alkaline. And then there are other factors that come into play in terms of diet. So what's very, very important with diabetics, and this is a global advice. It's not related now to stones or infections, etc. Is a general healthy body. And because remember, being diabetic also, there's a risk of obesity and diabetes. So you want to make sure that at least you walk regularly. With diabetes alone, many people advocate simple walking, for at least about 35-40 minutes per day. Doing it every day if you can, or at least 5 times at least in a week, so more regularly. That in itself has such a major effect on the overall health status, and it helps to have better sugar control, better bodily control. You feel better mentally, you feel better. And that all this helps you in terms of getting your glucose under control. As far as kidney failure is concerned, it's another big area, is to recognize that there may be a problem. Like I said, often it may be an association with other conditions. For example, there may be diabetes, there may be cholesterol also in that individual, there may be hypertensive as well. Obviously, their risk now of developing organ damage, whether it be the heart, whether it be the kidney, whether it be any other organ, is going to be higher. So if you fit into that category, you must be mindful of these kind of conditions. Have a regular check with your blood. Make sure you're checking your blood pressure regularly. Nowadays, people have machines at their home; they can check it themselves. Test your sugars regularly. Be mindful that I'm keeping my sugar under control. Now and then we're all going to cheat a little bit. People that are diabetic, sometimes they do have a bit of a cheat day or a cheat weekend or whatever it may be. But it's important to recognize, I've cheated now. Let me get back onto my program again. Let me check my sugars again. Get back into my medication or watch my diet for the next few days. So the balance is important there. When it comes to things like your bladder disease, these are things that's difficult for you to overcome it. But I think what we try to do was to make people aware that these are things that can happen potentially, right? There's no way that you're going to necessarily be able to, I would say, completely avert it. I mean, if there's a risk for you to develop vascular or nerve damage, it's likely to set in. How you can try to mitigate that is by living a healthy lifestyle and making sure that your sugars are under control, which is a big thing. Which is a big thing for diabetics. It's a whole lifestyle change, what they eat, when they eat, how they eat, and so that's the kind of mindset that needs to change in the individual. So I think, to summarize, Mariam, a healthy body will give rise to a lot of benefits in an individual, whether it be from their weight, their blood pressure control, their sugar control, and their cholesterol control. Those 4 things, I think are important for diabetics to keep in mind, to make sure that they they're not having those conditions, and if they are having those associated conditions, they need to manage them well, because if we put all those four together, the complications that are going to come up in the future can be very, very detrimental and very debilitating on an individual's life.
All right. Shukran so much for your time once again, Dr. Salim. And I think, well, that information will definitely go a long way in helping those who are diabetic and those who aren't.
Thank you very much. I hope so. I do hope so, inshallah. Thank you.
Shukran. Have a wonderful day. Assalamu alaikum. Dr. Salim Choonara taking us through urological complications that are brought on by diabetes, and a healthy life is, well, health is wealth. You know, one of the things that we have to take care of, take care of 5 before 5 is health before illness, and diabetes is one illness that, if is not controlled, could lead to things like kidney failures, kidney stones, UTIs, infections of different kinds, and other underlying conditions, erectile dysfunction, and it could basically make your life difficult than what it is now. So make sure that you live a healthy lifestyle. If you know that you are not a person who does live a healthy lifestyle, try to do it now. Try to get in as much water as you can. With the warmer weather, it allows for you to drink water. And don't do sugary drinks. Rather take water. If you feel like you need to grab something to snack on, grab a healthy snack instead. Grab a fruit, or just drink some water, because you'll find that sometimes you feel hungry and you grab food and it's actually water that your body needed instead of food. So that will also help you get in your 2 liters of water per day. And if you'd like some more information on kidney stones, UTIs, kidney infections, etc., we've done some in-depth work with the Dr. Salim Choonara, and you'll find those on the Salam Media Facebook page, or you can just send us a message and we will share the link with you. But for now, stay with us. We will be right back.